Cervical cancer is one of the major causes of death of women in Kenya and around the globe. This being a Cervical Cancer Awareness Month, the First Lady Kisumu County, in collaboration with Africa Cancer and Matibabu Foundation, issued scrubs to the medics around the Lake Region Economic Bloc with an aim to advocate for cervical cancer screening. During the inauguration of the cervical cancer campaign in Kisumu County at the Jaramogi Oginga Odinga Referral Hospital, Mama County Dorothy Nyong'o stressed on the importance of HPV vaccination and time-to-time screening in order to curb cervical cancer menace. She stated that cervical cancer is transmitted sexually and having such talks should be encouraged in order to create awareness.
My name is Dorothy Nyong'o, and I'm the County First Lady of Kisumu County. Today we are at Jaramogi Hospital distributing medical scrubs to the health workers to acknowledge them for the amazing work that they've been doing, but also to give them the responsibility of becoming ambassadors for cervical cancer. We want them to talk about screening, to encourage mothers to take their daughters for HPV vaccine. And the idea is to get cervical cancer detected early so that it can be treated. We are on the road to eliminate cervical cancer by the year 2030, as per the call from WHO. This initiative is an initiative of Matibabu Hospital, Tiba Foundation, Africa Cancer Foundation, and the Lake Region Economic Bloc to motivate the healthcare workers in this region. So the counties came together and discussed that, and we have been working towards promoting HPV vaccine, cervical cancer screening, and early treatment. There's some misconceptions about how people get cervical cancer, and it's important to note that primarily cervical cancer comes through sex, and so it is a sexually transmitted disease, and many people do not know that. And it's correlated with HIV in the sense that many women who have HIV will also be candidates for cervical cancer.
Speaking at the same function, the CEC Health Dr. Ganda called upon citizens to get vaccinated and get screened. He stated that with creating awareness on cervical cancer, the numbers of those getting vaccinated will increase, thus save more lives.
The number 2 cause of death as related to cancer amongst women in Kenya is cervical cancer. Breast cancer comes number 1, and number 2 comes cervical cancer. And usually I equate this to a classroom of girls per county, that every year, every county will lose approximately 40 women to cervical cancer. That is how big it is. So that is like a classroom dead every year. The drive that we have is actually a drive about life and making sure that our people can live longer, and then you don't die prematurely. For you to live longer, it means you must deal with things that will make you die early. And so things that we want to do are, 1, we want to make sure that all our girls between 10 to 14 years have gotten the HPV vaccine. Now, the HPV vaccine is given free of charge in all public facilities in this country. If we target to have 90% of them screened by the year 2030, then we'll be talking about our way towards elimination of cervical cancer on the ground. We in Kisumu and in the LREB region want to do it within the next 5 years so that we'll be dealing with new people becoming 10 years of age and not people whom we missed to give vaccination when we were between 10 to 14 years of age. The next thing we need to do is we need to screen 70% of our women by the time they reach 35 years of age. As a country, Kenya, we want to do 70% of all the women within the next 10 years from when we launched the cervical cancer screening guidelines almost 3 years ago, which means the next 7 years we want to have done 70% of all eligible women screened. The future is to screen them with a high performance test, and that is the HPV testing. But the second thing that we do when we don't have that in country is to use visual inspection under acetic acid. And the difference comes in the frequency of screening and the sensitivity. HPV is very sensitive, but quite costly and requires 2 visits. You need to come and then you'll come back for results maybe a week later because you will not get the results instantly. There are a few programs which can do it instantly, but that increases the cost because when you batch them and do them together, then the costs go down. And then we have visual inspection and acetic acid, which is what most of us are still doing, which is done yearly for every woman. So we are targeting to screen women between 25 and 50. Now that doesn't mean that after 50 you should not be screened. You still have a risk of getting cervical cancer after 50, but the risk goes down. And as a program, as a country, for us to save the most number of people, you need to look at the people where you have the highest yield, and those are the people between 25 to 50. Then finally, we need to treat screening and telling that you have a pre-malignant lesion. By the way, when you screen, you are told you have a lesion that can become cancer. So we need to treat 90% of those ones whom you discover have anything for you to be going somewhere. So I think we are doing poorly. Many of us are doing between 50 to 60%, meaning that you're able to identify that somebody has a problem, but then after that you don't do anything. So the national program has been training and with the partnerships that we have and ensuring that every part of this country has enough equipment to be able to treat those ones who are found to have pre-malignant lesions.
On his part, the CEO Matibabu Foundation noted that cervical cancer is the leading cause of cancer deaths. He also advocated for creating awareness on the same.
My name is Dan Ogola. Others call me Dan Matibabu. These are first facts that nearly 600,000 new cervical cancer cases are diagnosed every year. Every 1 minute, that is globally, every 1 minute, a woman is diagnosed with cervical cancer. Devastatingly, over 300,000 women each year die from cervical cancer. Globally, every 2 minutes, a woman dies from cervical cancer. Cervical cancer is the leading cause of cancer deaths in women in over 40 countries, including Kenya. Around 90% of our cervical cancer deaths occur in low to middle income countries. Kenya belongs to that. And so this is something that concerns everybody, men, women, and everybody within the community. We have to do something about the elimination or stopping the cervical cancer.
In attendance were the first ladies from Nyamira, Migori and Bungoma counties who stressed on advocacy. The County First Ladies Association managed to open Empower clinics in most counties. These clinics aid in cervical cancer screening and HPV vaccination.
The CHV or provider is able to use this to give the education. So it has information about HPV, information about cancer, it has diagrams and just being able to show the reproductive health system. Down here, we have now the steps that the woman can use to collect the sample. We also have the information in posters for them to just look at in the different screening points. It is in English, Kiswahili, and Luo. Also, for this platform, it also has in the 3 different languages. So, when you give the education, so maybe I can just take you through. You open the brush, and then you remove the brush, not touching the tip. So, as we do the education, we let them hold the brush so that they don't, during the education or the screening, so that they don't have any fears around it or maybe think maybe it's sharp or anything. So maybe you can try to have a feel of it. It's very, very smooth. So this is just during the education process for them to really understand, because you can look at it and get scared. Yes. So this is it. So as we give the education, we let them know of the steps. There is this tube. It has to be opened, facing up, put it in a flat surface, and then you have the opening the brush, and then for the position you either have your legs apart, squat, or raise one hand to a flat surface, and then you self-sample. You swirl it about 5 times. It's not a high vaginal swab collection, so whatever DNA is able to be collected, that's what we'll use. And then there is this section that has, it can just be easily broken. So they'll just place it inside this tube and then break it like this. And then close it. So this is taken to the lab. It can be a point of care. That is, it can just be processed immediately. But most of the time, due to logistics and everything, we able to batch them, and then it's processed. Yes. Results are between a day to a week. Yes.
So it depends with the batching.
It depends with the batching or the arrangements that you have. Either is okay.
Gaudensia Akenyi bet all odds after battling cancer for 2 years and 8 months. She underwent multiple surgeries and still undergoes regular screening. She called upon women to take precaution, which includes constant screening. I went to Eldoret where I had multiple surgeries, and until now I can't walk properly. I came back and was referred to Jaramogi Oginga Odinga Teaching and Referral Hospital, and it is the place I have seen changes. Cervical cancer is on the rise, and it is important we all go for screening, and it's the only way to save lives. Do not forget to like, share, comment, and subscribe to this YouTube channel. I'm Cindy Kavuchi.